Dear viewers, I have with me today Dr. SARAT Damodar, who is a world-renowned hematologist, stem cells transplantation specialist, and at present he heads the bone marrow transplant unit at the Narayana Hrudayalaya Hospitals, Bangalore. Doctor, welcome to Infosys.
Sure. It's a pleasure.
Doctor, the term stem cells is very new to us, and this conversation is going to be a good education for all of us and all the viewers. I have few basic questions to ask you.
Sure.
What is stem cells? I've come across different types of cells in the body: the brain cells, the red blood cells, white blood cells, muscle cells, etc. But what is stem cells? Number one. Second question is, what sort of diseases are treated in stem cells transplantation procedure?
Right. Now, most of us would have heard about various kind of cells, the red blood cell, WBC. These are the common ones which we hear about, in addition to muscle cells and brain cells, what you mentioned. Now, what is unique about the stem cell is that basically all these cells originate from the stem cell. So, the stem cell is the one which actually has the ability to differentiate into another type of cell, or it's sometimes called as the mother cell.
Okay.
And in addition, it also has this ability to go on multiplying. So it doesn't kind of differentiate and stop. All the other cells, what you mentioned, are end cells or terminal cells. They've all differentiated and they do their little function and they die off in their particular time frame for which they're supposed to live. Whereas the unique things about stem cells are their ability to go on multiplying endlessly, and secondly, they can also differentiate into various other types of cells.
Okay.
So that's what is unique about the stem cell.
Okay.
Now, typically, whenever we talk about stem cells, there are two types of stem cells we generally discuss. One is the hematopoietic or the blood-related stem cell, and the other is the mesenchymal, or the one which actually produces other kinds of tissues. So these are the two primary stem cells which we have. So the hematopoietic stem cell will produce RBC, the WBC, and the platelet, whereas the mesenchymal stem cells can produce all other types of tissue like bone, cartilage, muscle, neural tissue, cardiac tissue, and stuff like that.
Okay.
Now, typically the uses of stem cell traditionally has been bone marrow or stem cell transplants, where when you have a disease affecting the bone marrow, like say blood cancer for example, or thalassemia, which is another common problem in our country, there by changing this hematopoietic stem cell, we are able to cure the disease. So you've got a disease which is from the stem cell, the cancer or the thalassemia condition. You destroy all that with chemotherapy and then put in these cells from somebody else, provided they are matched, and then they will then cure the disease. So that's the classical application of stem cell treatment. Nowadays, with more research into the other kind of mesenchymal stem cells, people are now able to actually get other tissues developed from the mesenchymal stem cells. So in the lab, you can grow liver tissue, cartilage, cardiac muscle, brain tissue, and this is now trying to find applications in various other diseases. So if you have a heart problem, can we replace it with stem cells and then get generation of cardiac cells and put them back?
Okay.
If your liver is damaged, can we generate new liver tissue and put it back? So these are all very interesting uses now which are coming up as clinical applications, and this is another separate field of research and treatment which is now going on, and it's slowly coming into more as a treatment option for patients.
Okay. How simple or complex is the transplantation procedure, and how old is this technology?
This has almost been practiced from way back in the 1950s, where the first transplants were actually done for a child with immunodeficiency, and since then there's been a lot of progress from there. We've got better techniques of HLA matching to find the best suitable donor. There is usage of unrelated donors, cord blood being used. So there's a lot of research and development which has occurred. The treatment per se is not something which is very simple. It has its own complications, because you have to destroy the diseased bone marrow with chemotherapy, very strong chemotherapy, and then put in the cells from the donor, which can be either unrelated or sibling or cord, and that takes about 10 to 14 days to actually come up. So there is a period during which time the patient does not have his own cells and does not have the donor cells, and that's a very critical period for us to maintain the patient. High risk of infection, bleeding, complications coming up. So they need to be in a totally sterile room, which is the transplant unit. It's like an operation theatre facility. Patient is literally kept in as if put into a prison for about 3 to 4 weeks. It's a totally sterile place. Anybody going in has to change and come in. You get double cooked food coming in, sterile water. The air is all filtered. So it's an area which is absolutely sterile, and they need to be there for about 2 to 3 weeks, and that's the tough part of it. But most people will come through that, and once you're able to take care of that period, then they generally do well after that. So that's what makes it a little more cumbersome.
Okay. And doctor, I come across different terms. There is something called the cord blood transplant. Then you have this peripheral blood stem cells transplant. Then you have bone marrow transplant. Can you explain to our viewers?
Yeah.
And
now,
also in what situations patient you prescribe? Yeah.
Yes. Now traditionally all our stem cells have been from the bone marrow. That is where they originate, both the types of stem cells. And so originally when transplant was started, bone marrow was actually collected. So you harvested the stem cells from the bone marrow by taking the patient into the operation theatre, putting needles into the bone marrow and aspirating. Very laborious procedure. Anesthesia had to be used. Little pain was more. So this was how it was traditionally done. Then we started developing injections which can actually be given like how you get insulin injections. That will go and stimulate the bone marrow and kick these stem cells out from the bone marrow into the peripheral blood. So it's actually the same stem cells which we get from bone marrow. When they come into the peripheral blood, they are called peripheral blood stem cells. So they're actually the same stem cells. And then it's easy to collect that.
Exactly.
Just like how we collect blood, there's a pheresis machine. Just make the patient lie down, he's watching television, listening to music, no anesthesia. In 2-3 hours, cells are collected. It's about 200-300 ml, and then he walks out after that.
Okay.
So it's very easy, done outpatient procedure in the blood bank. Okay. So this is what is called as peripheral blood stem cell, and this is kind of almost replaced the traditional bone marrow stem cell procedure. Okay. In some situations, we would still want to use marrow. Sometimes in small children, we cannot do that kind of procedure. We would take them to the theatre and harvest when the donor is a small child. Some situations we need to do that. That's the time we would use that. Otherwise, a lot of it nowadays is peripheral blood stem cells. Okay. And this is what we encourage people to donate also when we say, just like how you donate blood, you can also become a stem cell donor. Those people, we would collect it like this. Okay. In the blood bank, outpatient procedure, 2-3 hours in the blood bank lying down, and then they finish the procedure.
Okay.
Now the last part what you told me is cord blood. Yeah. Now people have done a lot of research and found that cord blood also has got stem cells. These are very naive stem cells because not exposed to any antigens, and they can be used for a lot of diseases which can be cured with stem cell transplant. Initially all its usage was in children, but now using multiple cords you can transplant even adult patients. Now cord is something which is easily available, and in a country like ours which has so many children being born every year, huge numbers of deliveries, it's actually just getting thrown into the waste paper, into the dustbin literally. And if that can be collected and stored as a public cord blood bank, then it's something which can be used. Only thing is somebody has to do it, because you need funding to collect all that and preserve it and keep it. Government is not interested in that. The private people are interested in the private cord blood banks for their own sake, because that's where the revenue comes. This is something which has to be more, for the benefit of society, and that's something which would be a nice thing if it's done. The US has got this National Marrow Donor Program Registry. They have a huge cord blood bank facility, and a lot of transplant centers in the US are now primarily doing cord blood transplants. Always available, easy to get, no harm to anybody.
Correct.
So that's the best kind of source if you have enough stem cell numbers.
Yeah.
So it's kind of catching up as the novel treatment therapy now.